So it's real good to be with everybody again. Today I'd like to do another update, and there's some good news out there. So I'd like to go over some good statistics, some good news, as well as discuss briefly epidemiology, which is literally the study of epidemics. There's a lot of numbers being thrown around, so I want to walk through what some of that means because there's been a lot of deviation, variations, and changes, and so I want everybody to kind of appreciate a little better what all this means, and then the point of a lot of these things we're talking about. So some of y'all are familiar with Dr. Fauci, who's probably the country's top epidemiologist. Again, epidemiology is the study of epidemics. And one of the things they're doing lots of is disease modeling. Now, some of y'all remember back to the HIV days. People look at HIV. We actually had to predict out what was going to happen in the next 1 to 3 to 5 years. And one of the results of that was the mobilization of our country to actually find treatment for HIV. That's one of the things we do that these models are supposed to do. They're supposed to inform us for decisions. And so one of the questions is, when we get this information, we get this modeling, what does it actually do? Does it help us make good decisions? And you got to keep things in perspective, and perspective is absolutely huge. So one perspective is that the WHO, the World Health Organization, back in January 14th, said that some preliminary investigations showed no clear evidence that there was any human-to-human transmission from the COVID-19 virus identified in Wuhan. So why do I mention that? Well, because there's been a big change since then. By mid-March, we literally had a worldwide state of alarm, and there's a lot of changes. And so you have to understand what is kind of going on to appreciate that. 1 month, something that isn't transmitted between humans, 3 months later is a worldwide epidemic. And that's where just interpreting the data, kind of being able to wrap your brain around it and having people help you understand it is important. Data without understanding what it means, all it is static many times. So good news, there's an article published from England the other day, and this will be actually put below in the video where this is posted, talking about there's between 7 and 43 million individuals in Italy that have been infected. So that puts the infection rate between 1.88% and 11.43% of the population in Italy. Now, if those of you who've been following us know that we talked about a little study that was published 2 weeks ago in Vo, in a city in Italy, northern Italy, showing about a 2.4% infection rate. You also probably recall another study 3 weeks ago looking at a plane coming from Wuhan to the United States showing a similar infection rate. So the higher the infection rate, the better. The more people that are actually infected now without people dying means actually we're better off. If the infection rate is 11.3%, then the mortality rate is actually 0.6 to 0.3%. It's much, much less. Now, one of the good one of the good things about this information is that the mortality rate in Italy has actually dropped. Some of you all remember it was close in the teens at one point in time, and it was 8%. With this data, it shows the mortality in Italy being about 1.8% of the entire population. Now, so that's still a significant number, looking at flu being 0.1%, looking at the Spanish influenza of 1918 being 0.1%. But the point is, this is literally almost a 6 to 7-fold lowering of some of the original projections. What does that mean? That's a good thing, but again, this is still all preliminary. I think the point is, and if you look at the higher number of 11.43% and use that number, then it shows the death rate of this being 0.2% in Italy. So either this is a little worse than the common flu, or it's still pretty serious, but not as bad as we originally thought. So that's all good information. This is a moving target. One thing I want to let people know is the people that are true experts in this will commonly say, I don't know, we don't know yet, we still need more information. And those of you who follow Dr. Fauci and following his daily updates, you hear that a lot. And anybody who's really in the know is going to say that more often than you'd like them to say that, because we've only known about this entity entity was unnamed literally 4 months ago. So now everybody's a COVID-19 expert, including myself, of course, right? So some of the projections from this article as well, they're expecting the peak in the UK to be April 12th, which is not that far off. The peak disease in New York City is now, and this is from stuff coming from actually Bloomberg up in New York, that their peak they're expecting about April 14th around Easter time. So, and the peak in the United States being the end of April. So what that means is we have 2 to 4 more weeks in the United States before we see our peak here. And the hope is that we'll see it flattening out. We're already seeing it flattening out in certain parts of the country. We're already starting to see it flatten out in Italy. So we're already seeing signs that what we're doing is actually slowing the progression. But one thing to keep in mind, even if we use that 1.8% number in the United States, that is still 500,000 plus people that can die from this when they get it, realizing 80% of the population is ultimately going to get this at some point in time. If not now, in the fall, when we have a second wave. If not in the fall next year, as the coronavirus becomes instituted in our usual seasonal things, which is what typically happens. So, but my question is, what is our plan? I mean, data without a plan is just data. It just creates hysteria. If we come out of social distancing in the next month, which we can't do this indefinitely, will we have enough PPE to prevent a second peak early? That's going to be one of the big things. Even in Los Angeles, they're now talking about doing everybody wearing masks. That's what they typically do in Japan and South Korea during usual flu seasons since the SARS outbreak in 2003 to 2004. South Korea has always been kind of on the cutting edge of these kind of things. If this doesn't die out this summer, what's our plan? These are all things we need to think about. No one really knows for sure, but we need to start talking about them, asking our local leaders, because ultimately the national leaders are only making recommendations. Most of this is happening at the state and local governance levels. Like in Virginia, where I live, Governor Northam is making most of the calls for the state of Virginia. That's how we can be involved, by being educated and then talking with our leaders and saying, what's your plan? Because we can't just shut everybody up for 3 months. That's not feasible. Are we going to get personal protection equipment? Are the most susceptible individuals, the elderly, going to stay in while those who are healthy go back out? We don't know. We don't know. We just don't know. So face masks, there's been a controversy, and after this, I'm going to do a question section in another video today. But face masks have been a big controversy. Initially, the CDC said, hey, don't wear them, they don't work. Then it's like, well, only healthcare professionals like myself can get them, regular people can't get them. Now in LA, they're recommending wearing face masks. Governor Bloomberg is like, hey, maybe people should wear handkerchiefs. The big gist is this. Aerosolized particles can stay in the air for about 3 hours. And so a surgical mask is the best way to get those out. Water droplets, which fall there really quickly, can be mostly caught with a handkerchief or some material in front of your face. And then there's everything in between. Something is better than nothing. In the emergency rooms, when patients come in, if there's not PPE available, the patient and the physician is wearing a surgical mask, which is the lesser, the N95 being the better. If the point of the N95 for the patient is to prevent them from spreading, the point of the practitioner having the N95 mask is to keep them from getting and spreading. I don't know the controversy at this stage. I think the big controversy is just we don't have them. If you get one, keep it. These things last for weeks. I've been using the same one for the last 2 weeks because we don't have a whole lot of them. You don't need a new one every day. And hopefully these will be available soon. So other things to think about. Currently the thinking is we'll have a vaccine in 12 to 18 months. This is very optimistic thinking. We probably won't have one by early winter, but it is possible. There's a recent study I'll be talking about a little later from Pittsburgh showing a novel manner of vaccination that actually might be available come fall. But point is we have institutions, organizations working on a vaccine. If we get one by the fall, that'll be actually very, very quick. I'm not expecting it, but again, who knows? I'm hoping that it will happen. And then the next question is, will this actually effectively save lives? Is what we're doing with social distancing. If our numbers are 250 to 500,000 people are going to die from this, are we actually saving people, or are we just putting off the deaths till the fall? These are all questions that I have not seen any of the predictive models by the epidemiologists look out past August. And that's another thing to keep in mind. No one's saying, hey, we expect this in the fall. That's my question as a physician. Usually if these things come back around the fall, peak again, starting from November through March to May timeframe. What are we really expecting? Great questions. So what I'm doing right now is I'm encouraging my patients to take charge of their own health. For now, what does that mean? It means initially social distancing, which we're all doing, self-quarantine for those who have the disease, and then self-care. One of the ways I'm helping patients with self-care is educating them when they're in the office, doing these videos. I'm actually in the process of putting out a what I'm calling the COVID-19 survival manual, which is going to be hopefully full of a lot of good information that won't change. One of the things that's happening is information is changing quickly. I'm going to be putting in that, hopefully, information like face mask, hand washing, nutritional things, things to boost your immune system, things that have been time tested, and things that have a fair amount of data that won't be changing, so that this resource will be good come fall time as well. At the bottom of this, there'll be some other additional links and information. Please feel to continue to follow us. If this information has been useful to you, give us 5 stars, like us, follow us. That just helps this information to become more available to other people. So if you really feel this is useful, the best thing you can do is like us and share it. That way other people can have access to the information. As well, continue to leave comments. That's one of the ways we're communicating now with people, is the comments that gives us that lets us know what your questions are, so we can answer them, which is what I'll be doing in the next video, is answering some questions that we've been getting via comments on the social media. I hope you all have a great day. Stay safe. I'm going off to the office here in a few minutes to see patients. I'm working this weekend. My goal is to keep people out of the hospital, and the ones I see who are sick, to give them the appropriate treatment, including some of the newer things like azithromycin, and hydroxychloroquine, which I'll be talking about, answering some questions in the next video. Take care.